Welcome to the Optimal Bio podcast. At Optimal Bio, we don't just balance your hormones, we balance your whole body. Our conversations range from nutrition to medicine with an emphasis on wellness tips to support your health journey. If you like what you hear, find us on the web at optimalbio.com and follow the podcast so you don't miss an episode. Thank you for joining another episode of the Optimal Bio podcast. So today's topic is going to be gut health. If you've listened to Brit or myself talk on a podcast, you've probably heard us already talk about gut health because it's so important and we want people to understand the role it plays and why we always talk about gut health. So today is going to be focused on gut health.
My favorite topic.
Because it touches everything.
Touches everything. Yes, it's so important.
And also, we both have journeys with our gut health, so we get it. And we understand how it can make you feel and how it can make you feel better and just that ongoing journey of health, but especially gut health.
No, and I'm excited to share a little bit about our histories too, because I think it's important for everyone to know what we've been through and how we came out on the other side and all of it.
I know today I have one of my supplements sitting on my desk and someone was like, oh, is that a probiotic? I was like, oh no, this is taking out the bad bacteria from my gut, from my stool test. And I was like, telling you, I get my stool test all the time. Like, I don't just tell people to do it. So let's back up and talk about why is gut health important? And obviously we could talk about this for 7 days, but just an overview. Why is it important?
I think it's important to recognize that most people's guts are really messed up at this point. And this will lead into my conversation of why it's so important. But there's so much damage to all of our guts currently, from medications and toxins in the environment and the food system, chronic stress, sleep deprivation, like all these things have really kind of just like leveled out the playing fields for a microbiome, if you will. And I think that's really important to understand because our microbiome contributes to so much, not just digestion, but our allergies, like immune health, our skin health, our mental health. It can help sleep when it's optimized. So the list goes on and on. I think it touches like every area of health. And so I think it's really important to recognize that we're all kind of in this state of like, we need help with our digestive systems, but not just for digestion. There's so many other reasons why it's important. And we could, talk about this forever, but I think it just plays a role in everything.
I think too, sometimes people say your gut's your second brain, and it's like, yeah, okay. But what does that really mean? And when you're in utero, like when you are forming, the same tissue that forms your gut forms your brain. So it is so connected. And like you mentioned, like so many symptoms can come from your gut health. And because if your gut's not going well, the toxins are going to leak into your body and it's going to show up in different day-to-day symptoms. And then it can turn into, different chronic diseases, bigger issues down the road as well.
I'm so glad that you just mentioned that. I think like symptoms is a big word. A lot of times in my consult calls or my calls, I'll ask about their digestive symptoms or, gut microbiome symptoms or anything like that. And a lot of times they'll be like, oh no, I go regularly, right? I'm regular. But I think the list is much more than just, diarrhea or constipation. From a digestive standpoint or a gut microbiome standpoint, you could be deficient in B12 or vitamin D, and that could be a sign that you have issues with your gut microbiome. You could have anxiety or depression. That could be a sign, right? You could have acne or psoriasis. That could also be a sign that your microbiome's imbalanced. So when it comes to symptoms, I want everyone to think of it bigger than just diarrhea or constipation or bloating, which of course are big symptoms. Yeah. But it's more than that because it does, like we said, it touches on everything, not just digestion.
And I think too, especially with your skin, if something's wrong on your skin, it's telling you something's wrong in your body. It's like trying to alert you, and you can go and be on different medications or creams to try to fix it. But one, it usually doesn't fully work. And two, say if it does, it's going to come up again because your skin is literally trying to help you to tell you, hey, something is not right in your body.
100,000%. And I think you and I can absolutely relate to this. I don't know if you want to go into our histories at this point, but I think that's a good transition because both of us experienced a lot of skin stuff that no one really connected the dots for us until they did, about how it was probably our gut speaking to us. And just myself, talking about myself, I went years and years struggling with cystic acne, just horribly, probably from when I was like, I don't know, 16 to 21, maybe even more than that. When I started at Parsley, what was that, like 23? Yeah. So 16 to 23, I had acne and I went to dermatologist after dermatologist and did so many pills, so many creams, all of it. And not once did anyone say like, hey, maybe we should do a stool test. Hey, what are you doing for your gut health? Like, I always got, oh, your hormones are off. They weren't. I do a lot of work for my hormones. It wasn't off, but I did. And, every time they said something like, oh, just stop eating dairy. Oh, your hormones are off. Oh, go on birth control. Oh, let's try Accutane. Like, obviously I put my foot down on some things, but a lot of the things I tried. And then I kept thinking it was my fault, right? Like I was doing something wrong to cause this acne, even though I was trying everything under the sun, all the topicals, all the prescriptions. But underneath, I had an imbalance, right? And it wasn't until I started really diving into functional medicine when I finally did a stool test, I finally did a SIBO test, and I discovered I had SIBO along with a whole host of issues of imbalances in my gut. But yeah, once I started treating that, within a day, my acne cleared up. Within a day. It was insane. Like I have to show you before and after pictures one day. Because it was absolutely crazy. And my husband, my boyfriend at the time, was like, what the hell did you just do? Like I went from one morning to the next and it just completely cleared up. So, not saying that happens in every case, but for me, it was a clear, like, okay, I had clear SIBO. And as soon as I started addressing it, it went away. So that's all to say is it's just really important to really dive into every situation with a clear, open mind, because sometimes it's not, let's just rub some topicals. Let's just take more antibiotics. So at the end of the day, that's probably doing more harm for your gut microbiome than any good will come out of it, right? And I know you had a similar situation too with your skin near your gut.
Yeah, because growing up, I never had acne, never broke out, like beautiful skin, didn't even cross my mind of like how fortunate I was. And then when I was around like 27 is when I started breaking out. And I was like, if I didn't break out when I was younger, why am I breaking out now? So that was kind of a red flag amongst other things. But it was the acne, the migraines every day, the brain fog. That's what really scared me. I was at the post office one day and I couldn't remember our office address. And like, I'm not a dumb person. And I was like, either I have a brain tumor or like I need to figure this out. And that's what I'll never forget that. I was just like literally shipping a supplement to a patient and I was like, oh my gosh. And so that's what like started the whole journey. Of course, a deep dive. Of course, going to the normal GI doctor that got me nowhere. But also on the other hand, it made me learn and study and continue to learn more every day.
And that's awesome that you were able to then be your own advocate, right? And go down different rabbit holes and learn more and, all that stuff. I feel like a lot of people will go to that GI doctor and then it will kind of stop there, right? It'll be like, no, you're totally fine. You're normal. Or here's some medication or whatever.
The doctor was like, yeah, I do see a blockage, but like, let's just try an antidepressant. And I was like, wait, what? And I was like, absolutely not. And interestingly enough, I will give credit to this doctor. A few years after I had to go back to her because I was getting colonoscopy and she was local. My doctor's not local. And I was like, honestly, I didn't want to see her, but I'll be asleep. So it really doesn't matter. And she apologized because she like looked through my chart and she was like, I am so sorry, blah, blah, blah. And I was like, I appreciated her doing that, but I'm like, this is 3 years post. What if I just listened to you and never came back or, but I was like, I appreciate you apologizing.
I appreciate it too, but a little late. Yeah.
Because like you said, how many patients, I mean, we see patients every day, right? That are told, oh, you're normal. Oh, you're fine. Oh, you feel a little anxious. Here's a pill. And we'll never say prescriptions aren't right. Or, oh, you're brain fog and fatigue it's because you're a mom. So it's like, okay, cool. So I need to feel like this for the next 50 years of my life. Absolutely not.
I think it's so crazy to me that these symptoms become normal for people though, right? It's like, especially if they're internal, right? Like you and I, when we had acne, it's like a constant daily reminder, right? But if you are someone who wakes up every day with loose stools, right? That's not normal. But it becomes normal for people, and it becomes like not even like a secondary. I can't even tell you, like maybe 3 people over the past week that didn't even come to me for digestive stuff, right? They came to me for like weight loss or just optimizing their health. And we did a stool test and it came back. And I'm not kidding. Like one person had E. coli, the other one had Giardia. Like, yeah. And I'm like, you didn't even mention stuff to me about digestive.
I think it's a few things. I think because as a society, we're so sick and have just gut issues, so many symptoms are just normal. I also think we're so disconnected to ourselves because I now, through this whole process, I think I'm so in tune to anything that's going on in my body. Because I'll like say like a few months ago, I was saying something, I don't, long story short, and this person said to me was like, I've literally have never noticed anything like that about my body. So I think too, the combination of we're so disconnected to ourselves, not listening, kind of just pushing it off.
Yeah. And we also talk to people that are in our circle, right? Who our circle typically are like-minded, maybe with a few outliers, but most of the time it's people that are like-minded, eating the same similar foods as you, doing the similar things as you. You know what I mean? And a lot of us have these issues that we don't really talk about, or we talk about them like they're normal. Like, oh, okay, you only go to the bathroom once a week? Oh yeah, me too. Yeah. You know what I mean? And so it's becoming normal, which it's so it's terrible.
Some symptoms are like super personal, right? Like I was so bloated, and I'll probably regret saying this when I am 8 months pregnant, but like I felt 8 months pregnant. And then, right, then that affects my mind. Like it's all connected, but it's just, and sometimes it's like, where do you even start? Right.
No, I 100% can relate. I mean, I've been 8 months pregnant and I've had SIBO, and you feel very similar. You do. You feel very similar. And so, and for me, like it was chronic constipation, a lot of bloating. Like it wasn't just acne, right? And there's a lot of things that played into this. But I think you're so right. It's like, we're so in tune with our bodies now because we've been on these journeys, and this is what we do on a day-to-day basis, but we want other people to be in tune too with their bodies so they can recognize when something's off, right? Like, oh, I've been experiencing more headaches lately. Like, well, why is that, right? Let's take a deep dive and see, oh, you haven't been sleeping well lately? Like, why is that, right? I'm not saying that every single thing is going to be a gut imbalance, but a lot of times it can play a role. And I have yet to see a stool test that is picture perfect. And I don't think I ever will. I don't think I ever will. And I redo mine at least once a year, and it gets better every year, but it's still a very long way from perfect. So, I think all that to say is we can always work on optimizing our gut, and hopefully it kind of ripples down to optimizing everything else in the body.
And too, I think once you're on this health journey, then it makes like you're going to put the effort into buying non-toxic soap, how you move your body. It's a ripple, because I think sometimes once you know how bad you can feel, you don't want to go back there, which also then sometimes like honestly scares me, because I'm like, oh my gosh, I don't want to go back. Like, what if it happens? But I think, sometimes once you feel better, I think sometimes just like wait just a few weeks, put in some work, feel better, because then you don't want to go back to there.
Want to go back. I know. And then, like, I think once you've hit that kind of, I don't want to call it rock bottom, but almost like rock bottom in your health, where you like, something's got to change, something's wrong, like this is not how I want to keep living. And you get out of that. Yeah, it kind of, like you said, it makes you a little bit nervous and scared to go back. but you know now what brought you out. You have more information, you have more knowledge to kind of guide you so you don't ever go back. And that's kind of what the goal is, right? Is to educate and inform people about like, okay, well, this is what's going on. This is how we get out of this. And this is how we prevent from going back there. Right. And yeah, it's a journey. It's never going to be a linear process. Have I had pimples pop up? Yeah, sure. Have I had constipation again? Absolutely. But it's never gotten to that point again. And I've always been able to kind of gravitate myself out of it, right? Navigate myself. So yeah.
And I think too, reminding yourself, people, friends, clients you're working with, patients you're working with, is that wellness is a journey and you need to just keep building on it. And like, say specifically for me, like I'll be on like a treatment plan for 4 months and then we switch. So it's just like always reminding like, okay, just because it's working now, how it's okay to change it. And, it's not like I need to stay on this forever. Why is it not working now? It's like, well, what does your body need now? Why I love the stool test. I love all testing, but why we do the stool test? Be like, okay, what's going on now? How can we specifically supplements, whatever it may be to diet, yes, for what's going on right now and not just a guessing game.
Exactly. And I always say to my patients too, like, yes, do we have to do the stool test? No, it's totally optional. Like we can work off your symptoms. We can work off your lifestyle stuff right now and optimize with what I'm seeing. But at the end of the day, that's just a guess, right? It's a guess. It's an educated guess because I've been doing this for so long, but it is a guess. And so what I love about the stool test is it really specifically shows what's going on internally for you. And then we can tailor a program and a protocol that's absolutely targeted for what's coming up, right? Versus just like, okay, you have constipation, let's throw some magnesium citrate at you, right? So I think it goes beyond that. So yes, I am a big fan of the stool test too. Could talk about it to anyone who listens.
Right. And like, of course, like your health impacts everything. Like if you don't feel good, you're not going to show up and be the best version of yourself. Then that the relationship with yourself, your friends, work, having those symptoms of fatigue, headaches, pain, anxiety, depression. But 2, gut health impacts preventative. So, if your gut health isn't accurate, you're adding toxins into your body, you're increasing inflammation, which is the root cause of so many diseases and cancers. So it's just like, yes, you want to feel better day to day, but if you want to be able to hopefully, of course, life comes at you, but be able to impact your overall health, this really starts in the gut.
Agreed. I wonder, do you want to talk about some like little things people could do? And maybe we talk about like some things that we do too to improve our gut health. Yeah. So I have like a little list here, but I'll talk about some of my the things that I like absolutely love to recommend. And then I'll talk about some of the things that I do personally. I try to strive to do all these things on this list, but sometimes,
Consistency is key. So consistency over perfection is something I have to remind myself that it is okay. Yeah.
Agreed. And so if you can only do a couple of these, that's fine, but stay consistent with them, right? So number 1, I think I always strive to tell people to diversify their diet. So the gut microbiome loves diverse foods. I think a lot of us, myself included, get into the habit of eating like the same things over and over and over again, or like staying away from certain vegetables or whatever. Try really hard not to do that because our gut microbiome thrives off diversity, especially when it comes to fiber, prebiotic fibers, all of that, probiotic rich foods. I can go into that a little bit more too if you want, but loves diversity. So if you want to challenge yourself to have one new vegetable or one new thing a week, like that's cool. Go to the farmer's market, pick something up, try to cook it, and you'll go, thank you.
Like if you eat spinach and you don't feel good after, like listen to your body because you may not be able to digest it. So I think going that to like your body's telling you something, and just because, you think it's spinach, like I rarely eat kale and spinach now because I don't digest it well. And also it could be once you feel your gut, you're fine. But I think remembering to listen to your body too.
Absolutely. Absolutely. And that's a bigger sign too, right? Because like you said, once you heal your gut, you might be able to tolerate these foods, but you might not either, right? It's not always due to a gut imbalance, like food intolerances come up, but a lot of times it is. So yes, diversify, but also listen to your body. Don't want you to push it to the point of you're being in pain or uncomfortable, but yeah, microbiome loves diversity. This other one I think is so important. So allowing at least 4 hours, excuse me, in between meals for your migrating motor complex to do its job, which is kind of like the sweeping motion. It is so important. So versus grazing, right, periodically throughout the day, this is so helpful for your gut microbiome and digestion overall. So a lot of people I know, excuse me, I feel a coughing fit coming on. A lot of people I know will have like little bits of food here and there. Definitely not ideal.
Yeah, they say 4 hours. It's like the magic time for your body to digest, be able to handle more food. Because if you're just adding more food every so often, your body can't keep up. So then you're not going to be to digest it well, which then impacts so many things.
The other one I see has come up a lot recently, sugar alcohols. Yeah. Sugar alcohols, so damaging to the gut. So we're talking about erythritol and mannitol and sorbitol, right? A lot of like diet foods have them.
I think, yeah, people don't realize a lot of like protein bars, protein powders, healthy candies have these sugar alcohols.
Protein bars, all of it. Yep. So, not just like Diet Cokes and stuff like that, which yes, do, but it goes way beyond that. So always read the ingredients, always see if it does have sugar alcohols, it will say it on the nutrition label, sugar alcohols. If you are someone that suffers from bloating or diarrhea, these should be an absolute no for you, because all they do is they pull water to the gut, leads to more bloating, more diarrhea, not optimal. So say no to the sugar alcohols at all costs, for sure. One of the things I have started to do, probably, I don't know, maybe past 2 years, from a digestive standpoint, is breathing before my meals. And this is something I've really tried to stay consistent with. Number one, I recognize that I was such a fast eater before, which a lot of us are, or we eat in front of our desks, or we're eating standing up, or we're on the go. Excuse me. Taking 5 deep belly breaths before a meal can just prime your digestion, get things optimally going, and it brings you into that, parasympathetic, let's rest, let's digest state. So you're already primed to take on the food that's coming into your system. That's a really great tip too.
And not drinking while you're eating is huge. So it helps with digestion, but also blood sugar. So if you drink even water while you're eating, your blood sugar will raise more than it would if you were just eating without drinking.
Absolutely. And so one of the reasons that it decreases digestion when you drink while you eat is because it reduces your HCl. So we need enough stomach acid in order to digest, right? And so when we drink while we're eating, it pushes down the HCl, so we're not able to digest as much. So I'm glad you brought that up. It's a great point. And something easy that you can do, right? Like just drink on either side's your meal.
I think that's like so many of these things are easy, right? And just adding them like little by little, not all at one time, and then just becomes part of your life. You don't even think about it.
Absolutely. Agreed. I think that, one of the biggest tips that I have just from hormone balancing standpoint, gut health, all of it, is make sure that you are going to the bathroom every single day, at least once a day. And this one could be the hardest for a lot of people because, like we were talking about before, it's like normal for them to only go once a week, once every couple of days, right? And a lot of times that constipation is really like the thing that we need to address in order to get our toxins out of our system. So if we're not going to the bathroom daily, we absolutely need to. So we need to try to do everything at all costs to go to the bathroom. And that's something that I work with on a daily basis with my clients, my patients. I just think it's really important to make sure everyone knows constipation is not normal.
But also too, like, I don't think people realize what the definition of constipation is, or like realizing it. Because you say like the goal is like every time after you eat, which is like wild, but
Yes, ideal. No one does that except babies. Yeah.
But just knowing like if you are not going every day, like something is not right.
It's not right. And we need to try to figure out why, and that could be the stool test, right? Or stress or adrenals, all that stuff, right? But yes, but how do we stop that? How do we get you to go? And that's something that, I talk about at, ad nauseum with people, for sure. But I think it's really important to recognize that, yeah, if you're not going at least once a day, we need to try. Yeah, for sure. And so, yeah, I think all the other tips, like everything that we talked about is very easy besides like going to the bathroom a lot of times for people, which is like mind blowing. Yeah. But I know we both have been there, which like, yeah, yeah.
I think back, I'm like once a week. And I'm like, well, obviously that's why I literally felt horrific every single day. I'm like, got it.
Horrible. Yeah. No wonder I had cystic acne. I couldn't go to the bathroom. Yeah.
Or I was so tired I couldn't walk down the hallway. Got it. Like, awesome.
Absolutely. My estrogen was sky high because I wasn't going to the bathroom, right? So yes, I think back to those days and I'm like, I felt like going to the bathroom. I remember when I first did my first stool test, I was talking to my practitioner and I was like, I don't think I can go to the bathroom to get a sample for you. How am I supposed to if I only go once a week? And she was like, don't worry, you're gonna go. We did it. And eventually I got it, but it was like it was so scary for me because I was like, how am I gonna go? Like that's how bad it was, right? So yeah, I think going to the bathroom very important, but a lot of times it is a little bit more nuanced than like, okay, taking 5 deep belly breaths before a meal. So I say this with a grain of salt, knowing that like sometimes it's not as easy.
I just think it's helpful for people to know, like, oh, because like of all like my symptoms, that probably wouldn't have been the top. It would have been like my migraines, my fatigue, my just not feeling okay, my stomach pain, and that probably would have been like, oh, So it's like, yeah.
No one talks about it. Yeah, yeah. No, of course. Yeah. So no, I am a big fan of talking about it because then how else are you going to learn? What you're going through, if it's normal or not normal, and B, like how do you fix it, right? How do you optimize? So definitely. I also wanted to talk about just sleep in general, optimizing our gut microbiome. If we are not sleeping well, we are not recovering well, we are stressed out. It's just a whole negative feedback loop, right? Which can obviously impact our gut tremendously. So making sure we're getting enough sleep is also very vital for the gut microbiomes.
And two, I'm sure this is on your list, movement. You've got to move your body, whether it's walking, strength training. And I think too, depending on where you're at and what your symptoms are, for me personally, I was doing HIIT like every day when I was like at the peak of not doing well physically. And my doctor told me I had to stop working out because my inflammation was so high. Because working out causes inflammation, good inflammation, but then your body should be able to clear it. But if you're so inflamed and then doing HIIT workouts, it's just not doing well at all. Exactly. And so I was like, if I stop working out, like I'm going to lose my mind. So then I switched to Pure Barre, which I was like, I would never do Pure Barre. Like I'm not a dancer. And like I fell in love with it. I think it helped me heal so many things, right? But then just slowing down. So I think too, movement, but also where are you at and what does your body need? And now I like rarely do HIIT, focus on weights. I do HIIT sometimes. I love it. Don't get me wrong. But I think just knowing that and knowing what your body needs, because I think for so long, maybe especially for like girls, we're told like you need to diet in your workout, sweat, high intensity, but what does your body really need?
I think movement is so important just from eliminating toxins and getting, everything out. But yeah, sometimes it causes more harm depending on where you're at. But you're so right. I think that's like the hardest thing for women to overcome is that like switch from killing ourselves day in and day out at the gym to like, okay, I can do a 15-minute Pilates class plus a walk. And that's that's awesome. That's perfect, right? Because it's not going to leave you as like depleted as a HIIT workout would. And don't get me wrong, I love HIIT too. I do it once in a while, but yeah, definitely nowhere where it used to be for sure.
And I think too, yeah, it's a great reminder. If you're exhausted after a workout, something is not right. Whether it's your gut, hormones, you should feel energized after a workout. Because when people say that, I'm like, oh no, like your body should use that energy. Even I go to metabolic hard workout and I feel great after. So I think it's a good reminder. Like if you're exhausted every time you work out, something's, off.
Agreed. And I think it's different than, okay, while you're working out being like completely, that's good. We want that. Yeah. We want that. Right. But post workout, yes. If you're feeling like you can't open your eyes or you can't walk to the door to get, the mail or whatever, that's not normal. Yeah. Then you need to be recovering a little bit better. You need to take it down a notch. You need to eat a little bit more. Like there's lots of stuff going on there. So yeah. But yes, we do want to feel fatigued during a workout, just not afterwards. Yeah. Exactly. What else can we talk about from caffeine is a big one. It's a big one. Often the hardest thing that for people to switch is that no caffeine on an empty stomach.
Which I do every day. Yeah.
Most people do. Yeah. It is terrible for the gut lining. Really not great from a bloating perspective. I mean, when you think about it, coffee is like straight acid, right? And so it's not great. I love coffee. Don't get me wrong. It's huge. Don't come at me. I'm not a coffee hater. I drink coffee every day. Ideally, you would have some sort of food with it or a glass of lemon water, something that's going to help as that buffer from the acidity of the caffeine.
Yeah. I don't know if I can ever get there.
It's okay. We'll take it a little step by step. I know. I've been recommending this to you for like years, and I think it's never, it's never fully such.
I drink water, sometimes electrolytes, because I work out. And so I have my coffee probably 2 hours after I wake up.
Which is great. Which is definitely better. I talked to someone today who had coffee like immediately once her eyes are open, right? Like it's like the first thing she does. She was like, I put ice cubes in it so it's cool immediately so I can drink it like immediately, right? Which totally get, like sometimes we just need that cup of coffee, but that's not great from a gut health perspective, right? We want to space it out. We want to hydrate first. We want to have some sort of buffer.
So would you say like a glass of water? Like how much water?
Yeah, I would do a glass of lemon water before. Yeah, at minimum. Yeah, because the lemon acts as a buffer. It's actually basic. It's not acidic. So it helps to counteract the acid.
I would also add, yeah, we've talked about this before. I can add some water, but I'm not eating before lunch. Yeah, not happening.
Yeah, because I get that a lot. Like some people fast, some people aren't hungry in the morning. So like I get that. But from a purely gut health perspective, right? I'm taking out everything else out of the equation. We want to try to focus on a little bit more before coffee.
I need to focus on the water, lemon water. Yeah, I'm going to drink like half a bottle before, I don't know.
And it's hard. It's like routine too. Coffee is very routine. And so it's like we wake up, we start the Keurig or we start the maker or whatever it is, right? So it's like getting out of that routine. It's hard for people.
Also, all health, don't do a Keurig. That's a side note. All the plastics. I think, yeah.
That's something that I struggle with. I know, because it's like, I have no time.
Do an Nespresso.
Nespresso. We used to do Nespresso. I know. I should get back to that.
They do say it's better.
I know. I have no idea. That's something I haven't looked into because I'm like nervous about
Yeah, I do not drink a Keurig. Like,
I need to stop. I know.
Yeah. Once like all the fake estrogens, I can't get it out of my head. So there's no way. Like, I would rather not drink coffee than drink from a Keurig. And you know how much I love coffee.
Oh, gosh. Okay. Well, that's scary to know. Yeah.
And I think, too, speaking about water, electrolytes is super important for overall health.
Staying hydrated. Yeah.
And so many people think that sodium is bad for you. You need sodium. So the majority of your body is sodium. The sodium that's bad for you is the one that's in processed food. It has no minerals part of it. But Like I just was talking to someone today, have high blood pressure. The doctor said stop eating sodium. I'm like, we're missing so many pieces. So electrolytes are important.
I know sodium gets such a bad rap, and as to like eggs with cholesterol, and this is like a whole nother thing, but I just like boggles my mind how this is still
like two of the best things for you. Like
just like, I don't understand how we still think this. But it's what doctors are teaching still. So it's like, completely going over people's heads. But
go listen to Casey Means and all of the dots will be connected about sodium.
That thing that I posted today on my Instagram, she was like speaking to Congress. I was bawling my eyes out. If anybody listening.
The work that group is doing, like Max Lugavere, Kennedy, Casey Means, like, and especially like say Kennedy, like he doesn't have to be doing all of this. Like he could just be living life and not dealing with any of this madness.
They choose to, which I think is just it's so powerful. And the way that she speaks is just like, I could listen to her all day, but yeah.
Founder of Hue Chocolate is part of it. So go buy Hue Chocolate. But it's incredible to see.
And side note, they were talking about just like the systemic problem of health in the United States of America and the food industry and how that kind of relates. And it was just, it wasn't eye-opening to me because I know I've been in this industry forever, but it was just so wonderful to hear like her actually stand up for it. And I started crying. I was like, this is beautiful. It was really, and then it like fires you up, and then you just like, all right, what do I do? How do I get this solved? We can start with the gut. Yeah. And
exactly. And that's the thing. It's like, and seeing, we were doing a podcast this morning with Onward Physical Therapy, their office in Raleigh. And we were talking about like the healthcare system and just how like our job is to change it. Not that I see patients, but like by you guys seeing that one patient you see and then the next patient, it's just by seeing them, giving them the education, having a different conversation than they would elsewhere about their health.
Absolutely. And I think that starts by knowing, like, I want patients to know that they can have help, right? There are resources, there are people that they can go to trust and to learn and to educate themselves in like all of it. And there are tools and resources like the stool test, like Optimal Bio, like, there are things out there. So we just have to do our due diligence and spread the word, and they, hopefully will find us.
I think that's the beauty of like social media, Google, it can all be a disaster, right? But also we could do so much researching on your own and become your own advocate at a doctor, which is hard. But like once you know and you start learning and you start feeling better, like your job is to advocate, and it might be awkward and you might need to find a new doctor, but do it. Like we have so many patients that are like, well, my doctor said this, but I don't agree. Or I'm like, go find a new doctor. Like that. Yeah. It's like you are an adult, go find it. So I think being your own advocate is so helpful, and taking responsibility and learning and researching, and especially I'm not a mom, but thinking about having children, and like it is your responsibility then, like what are you giving your kid? Like the fact like the chronic illnesses and obesity in children should not occur. Like that's not how our bodies work, and it's sad to see that because kids don't know any better.
100%. There's also, I was going to say mini stool tests. There's stool tests for kids now. Tiny Health, I think the one that, yeah.
And you can do them for babies. Babies. Yeah.
But what I was going to say is your point before about like being your own advocate and finding a doctor that like you actually jive with. It's hard. It's hard. It's really hard. But like I always tell people, if someone comes to me and they're like, I didn't really agree with that. And I'm like, can you imagine if you didn't agree with like the pediatrician, what the pediatrician was saying to you? Would you stand by it and be like, yeah, sure. Like, let's just do that? Absolutely not. Like you would fight for your kid. Most people would be like, all right, let's like see let's get a different opinion. Like, let's try something else. But you're right. There are people who just like sit by and like, and I think that informed consent, all of it is just so important. Taking your own health into your own hands is so important, and allowing your doctor to be kind of like the guide, not the end all be all, because a lot of times they don't know what's what's best for you, and you need to do your own research. And I know it's hard, it really is, but there are providers out there that will listen to you and will help you and guide you and all that stuff. So, yeah, but yes, back to this little stool test, the Tiny Health, really cool. I saw one the other day. One of my clients did a stool test on her. I think I want to say he was like 6 months old. But I thought it was just so cool because they are like little stool tests now, which are really interesting. But the one that we use here, I don't know if I don't even know if I mentioned the name of it. But it's GI Map. It's the one that I really love and I recommend for my patients at Optimal Bio. And Diagnostic Solutions is the maker of the GI Map. And I absolutely love this test. Why I love it is it uses advanced DNA sequencing technology. So it can actually like detect the presence and levels, which is so cool, of the gut bacteria, viruses, parasites, fungi, all, you name it, which is so awesome to me. And that way you can get those targeted medications or the supplements, and you can restore your gut health through this test, through knowing exactly where the imbalances lie. So really cool. I just want to throw a plug out for the GI Map because I know they've heard us talk about the stool test, and that's the actual stool test we use.
I know. I'm already thinking about when I'm taking my next.
Give it some time. Yeah.
Yeah, exactly. I was like, give it some time. But I'm also like, okay, if I'm getting married in June, like I need to make sure everything's okay with my gut before.
You took it when? Like 2 months ago?
July.
So maybe like January, and that way you have some time. Yeah.
Yeah.
And that way you have some time to kind of like solidify everything. And what I also just learned, and I didn't know this, I was on a consult call with Rupa or Diagnostic Solutions, and they told me that you can repeat certain pages of the test. You don't have to repeat all of it. So say like H. pylori came up really, really high, and you didn't necessarily want to repeat the whole thing or pay, the $330 or whatever to redo the whole thing. You could do just parts of the test, which I think is really cool, as like a redo. Yeah. So if you wanted to do it sooner, like say after a protocol, after 3 months, you could redo just that specific part, which I didn't know. So that was really cool.
That is cool.
So yeah, a little bit more affordable in a way to see like, have your levels decreased? Is the intervention working? All that.
Yeah, that is really nice. It's nice to have options.
Yeah, but I love it, and I think it's important. And we could talk forever about different things to do, but I think honestly, what you said before is key. Consistency with these, easy little switches that you can make for gut health is the best. So if you can only, focus on one thing, like not drinking water during a meal, great, let's focus on that. And then maybe in a month or two, you implement a different strategy and help with gut health. So consistency is key. You don't have to overwhelm. You don't have to do everything at once. But yeah, the more you do things, the better the outcome.
And I think too, kind of to wrap it up, that we didn't mention are like cleaning supplies and beauty supplies. The chemicals in there play a huge role in your microbiome. So one of the first places really to start, of course, not all one time, throw everything, but be able to know that that is a huge role in your microbiome.
Absolutely. The toxins, right, in our environment. So yeah, I mean, it's not just from our food. It's everywhere. Laundry detergent, perfume, makeup, you name it. And I know we did a whole podcast on like cleaning up our beauty supplies and everything like that. So yeah, but I just think it's why all of our gut microbiomes are so messed up, let alone antibiotics thrown at every which way. But there's other stuff that's compounding that. So yeah, I think it's a great place to kind of start cleaning up and limiting your toxin exposure. And that way you have better gut health overall.
Yeah, it's key. I love it. Yeah. And I think too, last comment about like doing a baby stool test, because like I think it's super helpful because sadly of all the plastics and toxins that infants get literally immediately coming into the world, could be helpful to know do they have eczema? Do they have a rash?
And a lot of them do. Yeah. A lot of them do. And that's why they do the stool test, right? They have like unexplained eczema, and then they have food sensitivities a lot of the times, or chronic constipation, or like weird color stool. And so that's why I think it's just such a cool thing. And then you have to think about, well, why are these things happening immediately? But you're right. A lot of times they're exposed to harmful chemicals, like right off the bat. That's a whole nother discussion, but yeah, it's sad. So now I think it's awesome that there are resources and things that people can do for their babies to figure out, okay, well, where is this microbiome imbalance? But then also, how do I take action, right? Let's clean up the diet. Let's clean up the toxins in the environment. Let's get some house plants. Let's get an air purification system. Like, let's do it all.
Yeah. The diapers they're using.
Exactly. Diaper cream, all of it. So it's important. And I know it can feel really overwhelming. And that's why I like these tests, because I think that it like actually personalizes the steps that you need to take. It's not going to show you like, this is where you need to focus on, but that's where a practitioner comes on, right? And comes in and says, okay, I'm taking this information that the stool test has, and how do we prioritize this? Let's do these steps, right? Because otherwise it feels extremely overwhelming with all the things that you could do to optimize your health and wellness. So I think it's important to do these stool tests, but also to work with a provider who like can guide you and prioritize the steps you need to take.
And having a plan then it brings down the stress level, right? And it's like, okay, I have a plan.
Yep. I trust this person.
You want it to be a lifestyle. You want it to be easy as you're going, and not like a roller coaster of, the diet trends, right? But really making it part of your life.
Exactly. Couldn't agree more.
Anything else before we end?
I think that's it. Come see me and do some stool tests, everybody. Yeah.
I think it's a great idea. If we could have all of our patients do a stool test, we would, because it helps with so many things.
I know. I wish I could supply stool tests for all.
Right? Yeah. Maybe one day we could do that. That could be our charity.
Yeah, I'm a multi-billionaire. I'll supply stool tests for all. Yeah. I know. But I think it is so important. It's another investment towards your health, right? And yeah, I don't think it should be overlooked.
Mm-hmm. And I meant to say this before, but I think it's also, we could end it on here. Cancer rates are skyrocketing, right? And sometimes it feels so out of your control, right? And so many times can be, but I think it's also important to remember cancer can take like 10 years to present. And so by being healthy can a lot of times kill those cancer cells, which can be somewhat peaceful, right? In this environment of so many, but knowing that it really does
take control of something.
Exactly. It makes such a big difference of being healthy. So hopefully that can help, right?
Absolutely. There's one other comment that I want to say before we end, because you just made me think of it, even though it has nothing to do with cancer. But a lot of times I have people come to me with like 10 plus food sensitivities, right? And they're like, how do I stop this food sensitivity from, coming, or why is this happening? Can I do a food sensitivity test or whatever? And I want to say that those food sensitivity tests are like very, very, there's like no accuracy behind them. I think the best one I've seen is like maybe 80% accurate, which is pretty good, all things considering. But I want to say that a lot of times those food sensitivities are not actually because you're sensitive to those foods. It's a lot of times related to your gut health and your gut microbiome and something called leaky gut, right? And so while addressing your gut, what happens is a lot of times those food sensitivities go away. And that's what we were talking about before, right? Where yes, you have to listen to your body, but you also have to address the root cause of whatever is presenting. So, which is just another reason why I love these tests. It shows, where the imbalances lie, you correct them, and then hopefully we can introduce those foods again and test it out. So just another reason why I love it. And another kind of misconception, I think, is people think that these food sensitivities are true. And sometimes they are, but a lot of times they're actually not. And they're just due to imbalances in the gut. So
that's a great point.
I've talked enough about stool test.
In this. That's what people know. Like,
I know, but anybody has questions, they can always come talk to me, come see me, all that.
No, well, thanks.
Yeah, of course.
This has been a production of Optimal Bio. Optimal Bio is CEO Tyler Brannon, Medical Director Greg Brannon, podcast host Tyler Brannon, production assistance by Core Media, Beth Grabencourt, Administrator, Kevin Duthu, Executive Producer. The podcast can be found on our website, optimalbio.com, on Apple Podcasts and Spotify. Our theme song is Sunwave by Paradiso, provided by Epidemic Sound.